Hey, aloha gang, Dr. Russ Rosen here. Hey, listen, today's August 25th, day that I'm recording this. In the month of July and August, I've had more of my one-on-one coaching clients say to me that they've just had their best month ever than I've ever experienced in the last 20 years. Hang in there with me. Now, the reality is we're coming off of being shut down in COVID, just opening up again. And did these people do the things that we recommended in our COVID Kickstart program? Absolutely. But I want to tell you the one thing that these offices have in common, and that one thing is it's their messaging. They're talking about health and they're talking about wellness, and you can too. Listen, even Bill Maher did a really good video on this particular subject. Now, if you don't know Bill Maher, he has an HBO special. He's a wisecracking comedian, kind of left-leaning political kind of character. Now, regardless of whether you like him and his comedy or whether you like him and his political message, I don't care. You'll see a link below that you can watch this. But in it, what he's talking about is a Public Health England report done on July 24th, which talks about when you've got a 35 to 40 BMI, it increases the chances of dying from COVID by 40%. So we're not talking BMI, right? We're not talking percentage body fat, but let me see if I can get this here. For those of you who haven't seen it before, right about here is 30 to 40. So if you're looking more like this, or you're looking more like that, that's kind of 35 to 40. You've got a 35 to 40 BMI, you've got a 40% better chance of dying from COVID. You're above 40, you've got a 90% better chance of dying from COVID. A 90% better chance of dying from COVID. Another, and again, I'll have that link for you on that study. Another study talked about even mildly obese people makes it 5 times more likely that if you get COVID, you're going to end up in ICU. Right? So one of the things that Bill Maher talks about is he's saying, listen, shame on these health officials, on Dr. Fauci and these other health officials. And I'm not saying it, this is what he said in it. But I understand the sentiment for, they're talking about, all these other things, but they're not talking about lose some weight. Like that's one thing you can do right now. Yep, don't go to the mall and lick the railings, right? All that kind of stuff. And one of the other things that I thought was really valid that he was talking about was he said, for every PSA, every public safety announcement that you've been seeing on social distancing, right? On wearing a mask. And again, I'm not saying you shouldn't do that. I'm not saying you should do it. I'm simply saying for every public announcement that they're doing on social distancing and wearing a mask, he's saying there should be one on lose weight, because we know that that's one thing you can do for yourself. So for me, the message is really simple. Eat better, exercise, deal with stress, make sure your nervous system is functioning at its optimum. See true health care providers, not disease care providers. Do the best you can to be as healthy as you can possibly be. Now, if you saw our COVID Kickstart program, we went into great detail about that. If you didn't see it, you'll see a link below where you can see all of the 5 videos. But the second video we did was on the messaging. How do we communicate with our patients from the neuroscience of communications? How do we do that and ask Socratic questions to help them understand that they want to be a healthy host, that they want to be a bad host for bad bugs, right? So I walked through that entire process. If you haven't seen it yet or you want to see it again, you're welcome to click on that link and you can go ahead and just watch it. It's a 45-minute discussion on exactly the conversations we should be having. You can also take a look at the blogs and the videos that I've been doing. The last one was on the single most important question you must be asking your patients right now. Again, I think it's all really good stuff. So listen, there's no better time. We hear this all the time, but the truth is there's no better time to be an optimal health and wellness provider to help people get healthy and stay healthy versus just getting out of pain. Are we treating COVID? No, not at all. But here's what we do know. You've got a better chance of dealing with COVID or anything else that you get if you're at peak health. We know that. Now, again, I've talked to people who've said, well, I heard about that one, triathlete that was really healthy and they died from it. Look, we're playing with the odds here. That's all we're playing with. It's not going to guarantee you, but it's going to dramatically increase the odds. You look more like this, you got a 90% better chance of dying from COVID, right? Lose some weight, eat better, exercise, deal with stress, see health professionals, right? Not disease care, but health professionals who can help you work on your health and to be a strong host. Again, you'll see the links below on that study, on that Bill Maher video. Again, like him or not, I thought that the message was really good. And also, if you wanted to click on that messaging program that I have. So I hope that helps. Again, we've got more people right now that I'm coaching one-on-one that have just had their 2 best months ever in practice than I've ever seen in 20 years. The single most common thing is their message of health, and you can do it too. If you're serious and you're interested in making change. In fact, I'll go ahead and I'll put a link on this too. If you're serious and you're interested in making change, I'm doing 1-hour planning calls right now where I will help you get clear about where you're at, where you want to get to, and how we can best help you get there. You want to help people get healthy and stay healthy for a lifetime. We can do it for you. Please do not schedule this call and waste an hour of my time if you're not serious about taking action. All right? Otherwise, welcome to make that call. Love to get on Zoom with you, see the best that I can do for you. I hope this helps out a lot. Please share it with everyone you know. As always, much love and aloha. Bye, gang.